as a patient, what you observe as a patient when you're unwell, when you're on that ward, are issues when there aren't many staff members, staff rushing around, stressed. So from a workforce perspective, I suppose as a patient, you see the difficulties the workforce are facing, particularly from my experience at a bank holiday weekend, when there just didn't seem to be enough staff available from every division really, so from nursing right the way through to medical staff. From an NHS worker's perspective, the workforce issues that we often see are those related to the rotating of staff, having the right staff with the right skill set there to deal with patients or deal with clinics. And for me, you know, I often use FaceTime or Skype to communicate with my friends and loved ones. So why can't we utilise that technology for healthcare? Why can't we make things simpler? Apple had digitised CDs, Amazon digitised books, and I suppose my request was, could we digitise healthcare in some way, shape or form, rather than me as a patient who feels vulnerable, who feels unwell, having to travel, 45 minutes to an hour to get to an appointment, to get to a car park, maybe not find a car park space, and then to wait for an hour. But for me, I think that the future is definitely going to have a digital element. We have generations now, my generation and even my children and everybody who are more tech savvy. So it definitely is the future, because it enables us to go around our daily life as we already are, but just with the health element. We're using bank apps, aren't we? We're booking our travel on the internet. Why can't we see our own notes? Why can't we see when our next appointments are? We're doing everything else in our general lives in a digital way. Why would we not?